I go by the nickname Sally, and as I wrote in on the description of why I started this, is because I've been diagnosed with CRPS about 7 weeks ago, chronic regional pain syndrome in my left foot. I went in to have your routine bunion surgery. I have bunions on both feet. As you can see on my right foot, I still have the bunion. My left foot is the one you can kind of see from the scar here, is the one that I had surgery on. So what happened was I went in and had the bunion surgery, and that afternoon I was going over to my mom's house because she was going to be taking care of me after surgery, and my crutch gave out and I fell and I ended up hitting my surgical foot on concrete. It was in a protective boot, but they think because of the trauma of having surgery, and then hitting the boot, I had the boot on, hitting the boot on the concrete, that it kind of disrupted all the nerves. They call them sympathetic nerves. So after surgery, I was put on pain medication, and I wasn't getting any relief, and they tried a stronger pain medication, and I was getting no relief. It almost intensified the pain. So at that point, the doctor figured that it obviously wasn't from the bunion surgery itself, that it was from possible nerve damage. I went back for routine visits, and as my doctor was looking at my foot and looking at the skin, she said that in the back of her mind, she never thought she would see a patient with this in her lifetime, but in the back of her mind, she remembered studying in med school about this condition, and eventually sent me over to a neurologist to diagnose it. And then also we started the physical therapy. So I go to the clinic usually 3 times a week for a therapy called desensitization. And it's where you put your foot into like this machine, and it has the ground up corn husks, kind of like the consistency of sand. And what they do is they have you put your foot in there, and they blow the sand, which hits the skin, for a good 20 minutes. And that is supposed to help desensitize those nerves. So I've been doing that for, let's see, about 4 weeks. And I'm still on medication. I'm on a lot of gabapentin, and also on amitriptyline for pain that I take at night. And one of the doctors also had told me to take at least 500 milligrams of vitamin C daily, because he had read up on an article that he thought vitamin C helped with nerve pain in the long run. So I was doing all of those things and not getting any relief, and I had gotten 3 injections so far on my back to help with the nerve pain. But I think what finally was my breakthrough was I was kind of Googling this condition. And if you have this condition, you know that it's very scary when you Google it, because you feel like this is just going to completely ruin your life, change your life for the worse. But I was trying to find things to help myself at home, whatever I can do to get back to normal. So I had seen a little clip on a lady doing mirror therapy. It's called mirror box therapy. I believe she had a sprained foot with CPRS. And she was doing this mirror therapy, and she thought that it was helping her. Well, I tried it for a day. I gave up on it. And then a few days later, my mom went to get her hair cut from somebody that she normally doesn't get it cut by. And she was telling this person about my condition, and they said, hey, I saw this program on this mirror box therapy thing, for patients that have had, one of their limbs amputated, that it's basically you have to retrain the brain to make it think that the other limb is going to be okay, that it's okay. So I guess a lot of military doctors know of this, but it's not something that I've, heard from my doctor on how I'm supposed to do it, how many times a day. how many minutes per day. I've been kind of experimenting on my own. And I truly feel like this has been the breakthrough. I'm feeling better. Obviously not close to being normal. And I don't expect that because I know it's going to take some time for everything to heal. But at least it's something that, you know, if you've been diagnosed with this, it doesn't hurt to try it, because I know it's a very painful condition. My foot is always burning. I have like pins and needles all the time. And I'll just kind of go through this with you and just let you know how I start doing it. So basically I just have like it's, you know, like a bathroom mirror. I have it propped up. So here's my sofa. This is my good foot. My bad foot is behind the mirror. So when I first started doing this, I took this hand and just kind of put it off to the side. I didn't touch the foot, didn't touch the leg, nothing with the bad foot. So when I first started doing the mirror therapy, I try to do it a good 15-20 minutes 3 times a day. So when I first start, all I do is I'm looking at my good foot in the mirror. So for me, it's for my brain, it looks like here's my left foot, that I'm looking at a healthy left foot. So then what I just tell myself is I say, oh, the skin looks really good. Boy, I can move my toes really good. Anything positive, any positive thoughts that you can think about, you know, the good limb, you know, you just keep saying it to yourself in the mirror as you're looking at your good foot. If it's your hand, it would be your good hand. For me, obviously, it's my foot. So then after a couple of times of just talking about how good it looks, then I just kind of rub the foot, turn the foot. You can rub the bottom. I take my fingers and I just kind of pull on my toes. And as I do that, I say, wow, the temperature of the foot is really good. And boy, this doesn't hurt. Look at me feeling my toes. And so basically, for 15-20 minutes, 3 times a day, I've been doing it. I totally have ADD, so it's really hard for me to focus. So I understand if 15-20 minutes is a long time. Just do what you can. But I feel like the more you do it, the better chance you have of retraining your brain. So again, just looking at the good limb in the mirror. Then after a while, you know, my skin is real sensitive to the touch, so it hurts when you just touch the skin on the bad foot. But after a while, I found that I can take both hands. So what I'm doing on this foot, I'm actually putting my hand on my bad foot, and you just start out real slow. But after a while, I found that I could actually rub the good foot, rub the bad foot at the same time. And I don't feel the pain on the left side on the bad foot. The skin doesn't feel as sensitive. And then after a while, you can take each toe. So I'm taking my little toe and I'm saying, oh gosh, look at the toe. It looks so good. The temperature looks real good. Everything looks normal. As you can see, I'm doing it on my good foot and my bad foot. I don't tug on my big toe because that's pretty sensitive from just having the bunion surgery. But as you can see, and I just kind of take my fingers, and I'm still watching in the mirror as I'm doing this. Just kind of rubbing my foot. Just gentle. At any point, when you're touching the bad limb, or the bad area of your body that got diagnosed with this awful thing, at any point, if it starts to hurt, stop. Stop on the bad side, continue on the good side. You don't want to tell your brain that it hurts. So at any time, if you're touching the bad limb and the good limb, but it's still hurting on the bad part, you want to stop and then just work with the good one. So again, I'm just looking at the skin. I'm thinking real positive thoughts about how I'm going to be able to do all the things that I did before. I enjoyed running or jogging, exercising. I'm known as a person that can't sit still, always doing something, shopping, finding that deal. And I've been pretty much homebound here for the last 7 weeks, so that's been difficult in itself. But just try to surround yourself with positive people, positive music. If you're not a religious person, I'm sorry, because I feel like praying has helped me get through this too. And I just think that a positive attitude is worth more than you can imagine. So another thing that I've been doing is I feel like because I exercised before, I feel like it's still very important to do some kind of exercise to get that blood pumping. And you know, it's best for your limbs too if you do some kind of exercise to get the blood flowing. So for me, I can't really bear too much weight on this foot yet because of the bunion surgery and because the foot is painful. You know, it hurts. So what I have been doing is I have a recumbent bike, and I've been doing that. And then what I do is I take an ACE bandage, and it can be painful, but I take an ACE bandage, and you know, with the bad foot, you wrap it up nice and tight, and then I put it in my boot to protect my foot when I do that. But I try to get at least 30 minutes of some kind of exercise. If you look online or on Pinterest, you can also find some exercises where you're sitting in a chair, so there's really no weight bearing, but it's just something to get that blood pumping, that heart going, and boy, it feels good just to move. So I really hope this helps you. I hope that it'll give you some hope that there's some things that you can do at home, and you don't have to depend on a doctor or a physical therapist to make you feel better. Again, I think that it's changed certain things, and like my therapist said, it's not that you are expecting the pain to go away right away. We're looking for change. So since doing mirror therapy again, before I was not able to touch the top of my foot, and I am now. I'm looking in the mirror and I'm touching and I'm saying, gosh, it looks so good. And I'm not saying that throughout the day it's going to be exactly the same, because the sensitivity changes throughout the day. So, you know, there's parts of the day where I can't touch the foot, but I'm thankful for the times that I can. So I'm going to keep up with this. I hope it helps you. If you want to do it more than 20 minutes a day, I would say do it. Again, there's not a whole lot out there that teaches you how to do it. My physical therapist didn't have an answer on how to do it or how many times to do it, but I've seen change with what I've been doing. So again, it's retraining your brain to say it's okay. You're going to heal just fine. And I will update my blog. I'll try to do some more videos. I'll let you know how I'm doing. I have another, today is Saturday, I have another injection in my back on Tuesday. And I've got physical therapy Monday, I've got an injection Tuesday, I've got an appointment with my surgeon on Wednesday, I've got physical therapy Thursday, and again, my whole week has been kind of consumed with this, but I hope that you see this and you try the mirror therapy, and I hope, God willing, that it'll help you. Have a good day.